بسم الله الرحمن الرحيم والسماء والطارق وما أدراك ما الطارق النجم الثاقب إن كل نفس لما عليها حافظ فلينظر الإنسان مما خلق من ماء دافق يخرج من بين الصلب والترائب إنه على رجعه لقادر يوم تبلى السرائر فما له من قوة ولا ناصر والسماء ذات الرجع والأرض ذات الصدع إنه لقول فصل وما هو بالهزل إنهم يكيدون كيدا وأكيد كيدا فمهل الكافرين أمهلهم رويدا.
Right, Assalamu alaikum to everybody. Juma Mubarak. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Wassalatu wassalamu ala sayyidina Muhammadin wa ala sayyidina Muhammadin wa sallam. So, shukran for inviting me once again to Stigma Mosque to give this nasiha on the day of Jummah. And today I'll be talking about mental health and the impact that the COVID pandemic has had on mental health. But I think also it's quite fortuitous that you invited me in the month of October to come and give this talk, because the 10th of October has, for the last 30 years, been declared as World Mental Health Day. And for the first year, this year, for the first year, for the whole month of October in South Africa has been declared as Mental Health Awareness Month. So it's interesting that you've asked me to give this talk in the month of October. So what I would like to highlight is that the reason in South Africa we declared this as a Mental Health Awareness Month is to raise awareness about mental health issues in South Africa, also to help with mitigating against the stigma which many people who have mental illnesses suffer and are subjected to. So let's start with what is mental health. So as we know, mental health pertains to how we feel, how we think, and how we interact with others. So it incorporates our emotions, our psychological well-being, and our social well-being. And our mental health determines how we handle the stress, how we're going to relate to others, as well as the choices that we make. So mental health is important at every stage of our life, from birth through our adolescence, our adulthood, into old age. And even from an Islamic perspective, when we look at it, if you look at the maqasid of the Sharia, which is sort of the underpinnings, in terms of the Islamic rulings, what are the objectives of Islamic rulings? Usually there's 5 that are identified, one of which is preservation of intellect, preservation of the mind. So when one looks at the Quran, you see lots of verses where Allah tells you to think, to contemplate, to reflect. So I would really argue that we need the ability to think clearly, to have clarity of thought. But in order to do that, one has to have clear intellect. And so I would argue that our mental health is not just important for our well-being in the sense of physical well-being, but it's also important for our spiritual well-being, because through our mental health, through understanding, reflecting, thinking, is how we know our Creator. And that is also where our mental health is important for our spirituality. So, just coming back to the main topic, so according to the World Health Organization, over 1 billion people suffer with mental health problems globally. And we know that in South Africa, about 1 in 3 individuals will suffer with a mental health problem at some point in their life. And more importantly, every 40 seconds, according to the World Health Organization, somebody dies from suicide. And in according to our data in South Africa, our rates of suicide are at least 4 times higher than that of the global average. So these are significant problems, and many suicides are also as a consequence of mental health problems. So even before the COVID pandemic struck, there's been a chronic under-resourcing of mental health problems. So in South Africa, we spend about 5% of our health budget on mental health, but despite this, we find huge disparities, huge gaps in the provision of mental health services. So when one looks at this, we see that only about 1 in 10 individuals who have a mental health problem actually receive the care that they need. So coming back to one of the issues regarding the Mental Health Awareness Week, and that is of stigma. So this is one of the greatest challenges that we face with regard to mental health. And what we find is that unfortunately mental health is not given the same level of importance that physical health is given, and stigma remains a prevalent problem in our population. And even within the healthcare sectors, and even within the general population, there are many derogatory terms that are used to describe people who have mental health problems. Just common things like, he's mad, he's got a screw loose, in Afrikaans he's mal, hy moet aan die malle is toe gaan. So we see many of these derogatory terms being used, and unfortunately that creates a very negative perception. So people who have mental health illnesses are perceived as being less worthy, they're viewed with suspicion, they're seen as being dangerous, and the reality is, in fact, you're more likely to be harmed by somebody who does not have a mental illness rather than somebody who does. And unfortunately the media also contributes to this negative perception by portraying people in movies and television series, people who have mental illnesses as being dangerous, as being unpredictable. They portray mental health institutes as asylums where people are locked up, there's burglar bars on the windows, where they're shackled to a bed. And this unfortunately creates a very distorted and negative view in the public's perception of mental health care, and that in turn leads to further discrimination. And even from our own experience, I found within our own Muslim community, there remains many negative perceptions and misunderstandings about mental health. So I've come across concepts like, mental illness is a Western construct. True Muslims don't suffer with mental illness, and if you do, it's because you have weak iman or you're being possessed in some way. So they don't perceive this as an illness. And I've even come across families where individuals have been suffering with mental health problems for a very long time, and the families refuse to take them for mental health care for fear of stigma. And the irony is that when we look at our Islamic heritage, in the golden age of Islam, the Muslims were the first to build psychiatric hospitals and psychiatric wards. If you look at places like Baghdad and Cairo, they were pioneers in the development of mental health care and mental health services, and they treated mental illness as an illness and provided treatment for it well before the Western world adopted this. So it's important for us to address this issue of stigma in mental health, because stigma is a barrier to people accessing mental health care when they need it. So returning to the topic of COVID, if one looks at some of the broader challenges that have occurred with the advent of COVID and the impact this has had on mental health. Globally, we know that the COVID pandemic has been a public health emergency, and it's affected the well-being, the safety of individuals and communities across the world. And really, it's unlike anything that any of us have experienced in our lifetime. So it's not really surprising that many people have been feeling distressed, anxious, worried, concerned about the pandemic. And even though locally we've seen our rates of COVID reducing quite dramatically, we're still in a situation where there's no vaccination available for COVID, and more alarmingly, we see in places like Australia and certain European countries where there's been a second wave of COVID. So the reality is that the risk remains real, and there's still further uncertainty about the future. And when we look at the impact of COVID at a community level, we see a wide range of effects that the pandemic has had. So from our national lockdown, where we had our liberties in terms of our ability to move around freely and travel freely being restricted, we've had people confined to their home for months and months. We've had mass closures of schools, of workplaces, and then the subsequent mass losses of jobs, reduction in income, financial strain of individuals, and the lack of access to much needed resources. So is it not surprising that we see this wide range of emotional reactions in the population? So people feeling more distressed, and the development of psychiatric conditions. And we've seen from recent research that the rates of depression and anxiety have doubled and tripled in some cases in countries that have been severely affected by the pandemic. We've also seen across the world, in several countries, protests against governments as a consequence of the lockdown, a consequence of the restrictions that have been in place. And in South Africa, recently we've also seen, unfortunately, the rampant corruption and looting of budgets that were really meant to provide much needed PPE, personal protective equipment, for people. And this occurred at a time when the nation was really vulnerable and when we expected our leaders and our government officials really to be working and pulling together to support the country. And not to really take advantage of the situation, which unfortunately happened. And this then has impacted negatively on the national mood and the population, and this already on a population that was stressed. So this then translates into feelings of resentment, of anger, disregard for the rules of law, non-compliance with public health directives, and an increase in unhealthy behaviors. The pandemic, unfortunately, has also highlighted in South Africa the wide gap that we have between the haves and the have-nots, and also highlighted the severe shortages in terms of food, PPE, healthcare, and other services. And one of the dire consequences that we in mental health have recently seen is that as a consequence of the pandemic, there's been a severe shortage of many of the medications that we would use for mental health. And this has resulted in a number of patients, unfortunately, relapsing as a consequence of them not being able to access their treatments. So what we see is that the COVID pandemic has further diminished and already disrupted a healthcare system, a mental health care system that was already rather fragile, that already had limited access, and that was rather under-resourced. And this in turn then led, all of these factors rather, has then led to a negative impact on the population's mental health and their well-being. So just very briefly, what can we then do under these circumstances to help ourselves? So firstly, we should recognize that there are certain individuals and certain groups of individuals that are going to be more vulnerable at this time of psychosocial stress. So these are individuals that already have healthcare problems, that are already suffering with mental health problems, or have substance misuse problems, and also importantly those who are on the frontline healthcare staff and the frontline care workers are at greater risk of developing mental health conditions. So having some awareness of some of the common mental health symptoms might help to identify those individuals that might be more vulnerable or that might be developing a mental illness. So one should look out for symptoms like changes in mood, irritability, anger outbursts, physical changes, perhaps changes in sleep or appetite, changes in behavior such as aggressive outbursts, people that might be struggling to cope at home, cope at work, they may be becoming more withdrawn. So if you're starting to identify some of these symptoms, and more importantly, people are becoming so distressed that they're feeling that life is not worth living, they might be experiencing suicidal thoughts and feeling hopeless and helpless, it's important for these individuals to access help, and access to help is quite wide-ranging. You can go see a local doctor, there's help available through the state sector, even free help available and support available through national organizations like South African Depression and Anxiety Group and Crisis Line. So these are freely available support services. So some strategies that we can use and implement that will help us to reduce our stress. So one of the first things I would suggest is to spend less time on social media, particularly those news sites and social media sites that focus on the pandemic. Spending too much time on these sites might feel overwhelmed and also give one a negative perception. And unfortunately, there's also many fake news sites that are disseminating misinformation. So it's important to stick to reputable sites. Secondly, it's important to establish a routine. I know many people have returned to work, but there's still a sizable proportion of people who continue to work from home. And one of the problems is that people are struggling with regard to the boundaries between their personal life and their professional life. And I find many people are finding that they're actually working much longer hours, even though they're working at home, compared to what they would do if they had returned to the office. So it's important to establish a set routine where you have specific hours where you focus on your work, and then also make sure that you have enough time for other activities. And in particular, I would emphasize the importance of incorporating exercise into your routine. There's a lot of good evidence that exercise is important for your physical health, but also your mental health. And also it helps one to cope with stresses. It's also important to ensure that you have good sleep, good quality sleep and sufficient sleep. Also make sure that you have a good diet. And importantly, one should also take care of one's friends and family. So it's important to have a balance between taking care of yourself, but also taking care of others. And taking care of others can also be a good stress reliever for yourself. So maintain contact with your friends and family. Hopefully now that restrictions have been reduced, you can visit some family members, but you can also maintain contact using the telephone, video calls, and that will also help those individuals who may be isolated to feel less lonely. And finally, it's important also not to forget spirituality at this particular time. So there's a lot of good research that shows that people who engage in religion or active in religion and spiritual practices have lower rates of depression and anxiety. And from an Islamic point of view, we know the importance of prayer, and unfortunately as Muslims, prayer is actually incorporated into our daily routine, so it makes it easy for us. And from a psychological point of view, we also believe as Muslims that the challenges that we face from time to time, these can be tests from Allah, and we should respond to it in a particular way. And usually this response is with sabr, and sabr is usually translated as just patience, but it's a more comprehensive term than just being patient. It includes things like being steadfast, being perseverant, being diligent, being forbearing. So it's a lot more comprehensive than just being patient. And we know that there's many virtues to practicing sabr at the time of adversity. And also times of calamity, times of distress, is also a good time for us to increase in our ibadah, increase in our prayer, turn to Allah, ask for His forgiveness and ask for His help, and that's also good for us. So, in conclusion, our mental health, I would say, is arguably even more important than our physical health, but at least as important as our physical health. And we need to be aware that there's also a second public health crisis developing, and that is the rise in mental illness as a consequence of the COVID pandemic. But this is a silent pandemic. And if we don't really address this, this is going to have far-reaching health, social and economic consequences for our population. So this research shows that, for example, investing $1 in the treatment of common mental health problems, for every $1 that's invested in treating depression and anxiety translates into a $5 recoupment on investment in terms of improved health and productivity. So during this mental health awareness, we should not only be raising awareness about the mental health, but also we as citizens should be advocating for better mental health services, and we should be getting our governments to commit to increasing the investment in mental health services. So finally, there is no health without mental health. So shukran for your attention, and I would like to ask you on this day of Jummah, please make dua for us, make dua for our family, make dua for our ummah, that we are able to persevere and we're able to get through this pandemic. Shukran.
اللهم إنا عبيدك بنو عبيدك بنو إمائك نواصينا بيدك ماض فينا حكمك عدل في قضاؤك نسألك بكل اسم هو لك سميت به نفسك أو أنزلته في كتابك أو علمته أحدا من خلقك أو استأثرت به في علم الغيب عندك أن تجعل القرآن ربيع قلوبنا ونور صدورنا وجلاء أحزاننا وذهاب همومنا. اللهم إن هذا المرض جند من جنودك تصيب به من تشاء وتصرفه عمن تشاء. اللهم فاصرفه عنا اللهم فاصرفه عنا وعن بيوتنا وعن أهلينا وأزواجنا ودرارينا واحفظنا مما نخاف ونحذر فأنت خير حافظا وأنت أرحم الراحمين. اللهم اجعلنا ممن دعاك فأجبته واستهداك فهديته واستنصرك فنصرته وتوكل عليك فكفيته وتاب إليك فقبلته يا رب العالمين.